Howdy everybody, it's Angelo from Daily Vital Moves, and I know many of you could be troubled with sciatica or sciatic nerve irritation, and that's when you have pain in the gluteals or the buttock region that can extend down into the back of the thigh, into the side of the lower leg, or into the foot. And you definitely want to have this checked out by a doctor or a healthcare professional that can assess your situation. However, there is a common situation that can elicit the same sensations as sciatica, and that's when the piriformis muscle, which is a muscle that comes across the back of the hip, is tight, and that can be caused from a lot of sitting, or for men if you sit on your wallet a lot, or do activities that have repetitive motions of the hip. And when that piriformis is held tight over a period of time, it can start to compress on the sciatic nerve, because that nerve actually can travel through the piriformis muscle or underneath, and when it's tight it can compress the sciatic nerve and cause these similar sensations where you have pain in the buttocks and down into the back of the thigh. So today, hopefully this helps some of you with this situation. Let's get to it. Okay, so what we're going to do is come sitting, and we're going to contract our piriformis muscle here in the back of the hip. We're going to bring one leg straight, the other foot we're going to bring up and across the other knee. And you can, if this is a tough position for you, you can bring one hand behind you to help support your weight. And what we're going to do is we're going to bring this knee across a little bit as far as you can comfortably go. This hand is going to hold and support, and we're actually going to press our knee and hand into each other. Okay, so my knee is pressing this way, my hand is resisting that movement. So there's not going to be any movement, it's going to be isometric contraction. And then you'll feel this piriformis muscle here contract in the back of the hip. Okay, so we're going to hold that 5 seconds and then slowly relax. And this is going to calm down the tension on the piriformis. If this is bringing up more pain or sensation through here, just maybe back off a little bit and start at a more relaxed position with your knee maybe a little bit dropped. But if you can, after doing that first contraction, try to bring it further across. So now we're stretching this piriformis muscle a little bit more, and then we're going to hold that contraction again in that lengthened position. So we're contracting, relaxing, bringing it in a more longer position, and then contracting again, and then relaxing. Okay, so you want to do that on both sides, and this is the reason, because one side could be tighter than the other, and that can contribute to the other side being weak. So even though we're doing the same thing on the other side, it can help stimulate that muscle to work a little bit more and balance the tension of both sides of the piriformis in the back of the hips. And after you've done that a few times, we're going to bring in some movement into that muscle. So we're going to stay here, but we're going to bend both knees so our feet are flat on the ground, and we're going to do what I call knee drops. Okay, you're just going to let one knee drop towards the ground. The caveat to this is the other knee, it may want to drop as well to the other side. As best as you can, try to keep that in the same place as this knee drops inward. Okay, so what we're doing, we're internally rotating the hip or our femur bone here, and that's putting a stretch on the piriformis. So we're actively using opposite muscles to bring a stretch into the piriformis. And then come back up, and then we'll switch to the other side. Again, if this you're feeling irritation in the back or in the hip, go within your comfortable range, and just bit by bit you can maybe go a little bit further. Okay, if you want to increase the challenge, you may notice that when you first start, your body's going to want to be leaning back a lot. So As you start to get a little bit more movement, you can start to bring your body a little bit more upright and then continue the knee drops. You may not get as far as you originally did, but this is one way to start to challenge that motion a little bit more. All right, I hope you continue to find this movement useful to help keep your hips healthy. Please feel free to share it with your friends and family. And here's to making moves that make a positive impact on your life. See you next week.